Colorado is approaching a new phase of COVID-19, the transition from pandemic to endemic.
That has local hospitals looking towards the future and examining how they will handle the virus moving forward. KRDO News Channel 13's Mallory Anderson is live in studio tonight after talking with two Colorado Springs healthcare systems about their plans.
While healthcare systems can finally move out of crisis mode, the governor's office still has expectations and wants them on alert for potential surges of the deadly virus. Two Pikes Peak region hospitals tell me they're prepared for the challenge.
You've done your part, Colorado.
Governor Jared Polis has said those who are fully vaccinated can live their lives as normal. Both Centura and UCHealth agree with the governor. But a major part of moving on is staying alert. Each health system says they've been working on their hospital readiness plans, even through high-capacity moments.
The most important thing that has been implemented are some of the lessons that we've learned in terms of coordinating, trying to increase that capacity, not necessarily by building physical hospitals, but ultimately by coordinating and building up the virtual capacity that we have to match patients' acuity or their illness with a specific facility.
We've adapted a plan where we can actually surge into rooms, into doubling up if necessary, figuring out ways that we can cross-cover with nursing staff to stretch to be able to cover that, making sure that doctors are helping each other out to be able to cover that. So we have plans in place that we've actually enacted, not as a test scenario, but in real life as we go with this.
The future also eventually means treating COVID patients in a normal medical setting.
Understanding this particular virus and the limits of the risk to the virus and what it actually poses as a risk to your patients and to your staff is one of the best ways to sort of bake that into regular operations. So understanding how much PPE to use and when, understanding when to test and when you don't have to test, understanding how to cohort people, this is all part of the operations.
Centura and UCHealth say this is a pivotal moment for recruiting and retaining healthcare staff. Our full discussion about how they plan to do that can be found right now on KRDO.com. In studio, Mallory Anderson, KRDO News Channel 13.